Good day and welcome to all our participants that are viewing this afternoon. My name is Airrion Andrews. I am with the communications team at Families USA. And I'm going to be joined by three guests, Chris Wyant of Enroll America, Sarah Bagge of Families USA, Health Policy Analyst with Families USA, and Jenny Sullivan, Director of Best Practices Institute with Enroll America. And today we're going to be talking about enrollment and eligibility and really some of the best practices or methods specifically to kind of outreach and engage communities of color. And there's kind of the new health insurance marketplaces that are going to be opening up this coming fall in October 1st. And some people may have heard of these marketplaces, and I wanted to start out by basically highlighting that there's a large gap of understanding or awareness about eligibility or enrollment in these marketplaces. Enroll America's data says about 72% of people are unaware or don't know much about these health coverage options. And within communities of color, I think that gap's a lot larger. 15% of Americans are uninsured, and those numbers are even worse for communities of color. 17% of Asian Americans and Pacific Islanders are uninsured. 20% of African Americans are uninsured, and 30% of Latinos are uninsured. So now I want to just welcome our guests and turn and kind of get into discussing this topic, and a very important issue in the next coming weeks and months. Chris, can you, and I think I've touched on this already, but can you talk a little bit more about the need or more so the lack of awareness and kind of what the goal of Enroll America would be?
Yeah, sure. I'd love to. I'll talk a little about, reemphasize some of the numbers that you just shared, talk a little about some of the research that Enroll America has done and how best we can connect with those that are uninsured, talk a little about what our campaign is going to look like, and then give an update on where we are in that process, because we're actually happen to be talking at a pretty exciting time. So first, just to reiterate the numbers, 72%, or our research suggests that 72% people aren't aware of the fact that there are going to be these options available come October 1st. Further, among the uninsured, those numbers are even higher. 78% of uninsured adults aren't aware of these options. 83% of those part of the Medicaid expansion population aren't aware. So it's clear that there's a lot of work to be done in the next 6 months going towards October 1st. And if people are going to benefit, we just need to increase awareness. So how are we going to do that? First, just to talk a little about the research that we've done, I think there are three things to think about that are really important. Just to kind of frame it a little bit, we have to have the right messengers, we have to have the right message, and we have to use the right channels to communicate to the uninsured. So first, just on the message, I think there's some really important facts to understand that I think in our research suggest are compelling to both inform people but also mobilize to take action. There are going to be new affordable insurance options for people without insurance. And all insurance plans will cover doctor's visits, hospitalizations, maternity care, emergency room care, and prescriptions. Financial help will be available for those so that it fits within their means. All insurance plans have to show costs, and there's not going to be fine print, so there's going to be real transparency on that front. Insurance plans can't deny for pre-existing conditions. And Jenny, I think, will talk about this at more length later, but there's going to be help available in person, on the phone, and online. So I think those are some important facts that we really need to work to get out there. And kind of within those facts, I think talking about some really, thinking about the affordability, financial security, and the plan security are important to articulate. So that's the messenger. And I think messengers are important as well. In the research that we've done, and this won't surprise you, the people that are most trusted to communicate these messages, doctors, family members, someone who's gone through this process, someone else who is uninsured and has gone through the process successfully and can talk about their experiences, and some government officials, folks from health agencies at both the state and federal level can be important advocates. And then there's the channels. I think obviously in person is valuable, but actually a plurality of people suggest that they expect to get their research online through search engines and other means. And I'll talk a little about this in a minute, but that really emphasizes that while we're going to focus on person-to-person communication to express those messages, we also need to think about online and TV and radio, because there are really a lot of different ways to get to people to communicate these messages. And so what's the campaign going to look like? I think we've really tried to look at some of the successful campaigns in recent years, electoral and issue in particular, that I think have really progressed dramatically in their effectiveness. And so I think there are 4 important themes there: being grassroots focused, being coalition based, using some of these latest digital and social tools, and also using the latest data and analytics available. So just on the grassroots focus, and I worked on a campaign in 2012, and a big part of our effort was having people in communities have conversations on a person-to-person level, whether that's on the doors, on the phones. But it wasn't just, it's about finding those neighbors. It goes back to the important messengers. How do we design programs that have moms talking to their sons, neighbors talking to their neighbors, people within the health industry? How do we engage them? And so really being grassroots focused in that regard, and community-based organizing. I think on a related note is building coalitions. Enroll America for nearly 2 years now has worked to build coalitions on both a national and state level. Many of those partners of ours are partners who have been in communities for a long time, and again, I think are valued messengers. And so an important part of our campaign will be making sure that those partners have the information and the tools necessary to get the word out and really both inform and also motivate the uninsured to take action. And then next is digital. And again, I think everyone, I'm a bit old school, so I do, wherever possible, want to have a one-on-one conversation with someone in person. Sure. But digital, there are means to really get to a lot of people quickly. And looking at some of the cutting-edge online and social tools, I think are ways to communicate, and particularly when you look at the uninsured, many are younger and spend a lot of their time online. So that's going to be an important part of our campaign. And then the last is being really data-driven and focusing on the analytics. As I said, we've done some research in Enroll America, and we have a sense of what messages on kind of the macro scale are most effective. But as we engage in communities on the local level, whether we're in Dallas or in Tampa or in Columbus, what are the most effective messages to people in those communities? How is it impacted depending on their age or other considerations? And so building out a real robust aspect of our campaign and making sure that we're tracking all of those communications, and as we see things that work well, modeling that and improving it. And that's something that we'll do internally for our campaign, but also be sharing with all of our partners who are going to be doing so much of this work. And so that's kind of the overall frame of the way that we're looking at the campaign and trying to conduct this outreach. And as I mentioned earlier, today is a pretty exciting day because, as you probably know, tomorrow is the 3rd anniversary of the ACA, which of course makes October 1 possible and makes this, getting this health coverage possible. And so in conjunction with that, we have house parties across the country in about 12 states with people, with potential volunteers and activists and healthcare advocates sitting around tables and talking about what can we do in the communities, how do we find the right messengers, how do we make sure that we articulate that message. And in conjunction with that, we've launched a new website, getcoveredamerica.org, and we have a new Twitter account and Facebook, so we're trying to begin that presence in kind of in the early stages of that campaign that right now is just launching, but of course in the coming months, seeing as we have just 6 until October 1, really begins to talk directly to the consumers and to those people that will be so valuable as messengers.
Okay. So again, I guess I understand outreach is extremely important this year, especially, right? Because it sounds like you guys are doing a huge kind of push going forward. What does it take, with the mention of these house parties and trusted messengers, what does it take to kind of engage and reach communities of color? Is that what you're kind of focusing on?
Yeah.
In terms of the broad spectrum of your outreach goals.
Yeah, absolutely. And I think this goes back to some of my experience in other organizing efforts, recognizing that you have to find a way to get to people where they are and find a way to talk to people in the spaces that they want to be. They want to have those conversations. So in some communities, it's about working within their place of worship. I think it's going to be very important to talking to faith leaders and doing that work. In some cases, it's small businesses. And so if that's the barber shop or the beauty salon, or if it's the mercadito, finding a way to get some of those small business owners who often are considered leaders in the community to talk to their customers as they come in, and making sure that people are aware broadly. I think are just some of the tactics. And again, I think working really closely with partner organizations who have those relationships with people in the communities.
Okay. Well, thank you very much, Chris. Now I want to let me reiterate for those members of the media that are viewing right now, I do want you to have an opportunity to send in your questions. Send your questions to bfisher@familiesusa.org. That's BFISHER at FAMILIESUSA.org. And we'll get those questions kind of hopefully answered during this segment. I want to go ahead and turn to Sarah Bagge, Health Policy Analyst with Families USA, and kind of discuss hopefully what consumers will see when they kind of begin to apply, such as say the online application. Can you tell us a little bit more about that?
Absolutely. So once the folks at Enroll America have sort of done their job of letting people know about these new coverage options that are out there, and done the work of convincing people that there is something available for them, we also have this hugely important step of getting people through the application process and enrolled in a plan that works for their families. So I want to talk a little bit about what we know about that consumer experience so far. So people will have to apply for these new sources of health coverage, and they may end up getting Medicaid, they may end up getting help paying for private insurance through tax credits, or they may be eligible to buy a plan in the marketplace. And so sorting out who goes in which program is a bit of a complicated process, but thankfully the folks at the Department of Health and Human Services are working very hard to make sure that the complicated decisions about eligibility happen behind the scenes, and making the process for consumers as easy to understand as possible. So it's still definitely a work in progress. We're still a little ways out from October 1st, but I want to talk a little bit about what we know about how that process will work for consumers so far. So one thing we know is that there's no one-size-fits-all approach to applying. People will have different preferences in terms of how they want to sign up for health coverage. So some folks who are more computer savvy and comfortable on the internet will be able to take advantage of applying online and do that on their own time, maybe in the evenings or on weekends. Other folks would prefer to have somebody help them through the process, so would prefer to talk to somebody on the phone or talk with a trusted member of their community to work through the application. And still other people prefer to fill out something hard copy that they can see, a paper application. So recognizing that, HHS is working on creating 4 ways for consumers to apply: online, in person, by phone, and by mail. Now, we expect that most of the applicants who are going to be getting coverage this year are going to use some form of the online application. So whether that's going online and filling that out themselves, or talking to somebody on the phone, or meeting with somebody in person who will just be walking them through the online application. We know from experience the state that has the application that looks the most like what the Affordable Care Act application will look like is Oklahoma. And 94% of Medicaid applications in Oklahoma are now done online. So we're really expecting that online format to be the one that most people use. So I wanted to talk a little bit about step-by-step what will that process look like for families who are signing up for coverage. So the first thing people do when they go to apply for coverage is to set up an account. We recognize that not everybody is going to be able to fill the application out in one sitting. They may need to go and get more information, or they may have something that interrupts them in the process. And setting up an account will allow them to save their information and come back to it later if they need to. It also allows them to continue to update their information and receive updates over time, even after they've gotten enrolled in coverage. So once an applicant has filled out filled out that My Account section, they get to move into the full application. And the application asks questions basically about who's in the household and what sorts of income they have and how much income they have. And there's two important ways that HHS has made this application easier to fill out. The first way is they've made it a dynamic application. And a dynamic application is one that learns about the person who's applying as the application moves forward and uses that information to make sure that that applicant only sees the questions that apply to them. So if a man is filling out the application and indicates earlier in the application that he's male, he's not going to get questions about pregnancy. Or if it looks like a family will be eligible for Medicaid, they aren't going to be asked questions about whether or not they can get coverage through a job because that doesn't apply to them within the Medicaid program. So HHS estimates that this dynamic capability of the online application will mean that each applicant has to answer less than a third of the possible questions on the application. So that's a big saver of time and make sure that people don't have to fill out things that aren't necessary. The second great thing about this online application is that it's been heavily consumer tested. HHS has gone around the country and sat down with consumers who are likely to be eligible for Medicaid or for tax credits in the exchanges, and had them work through the application and taken note of, what are words that trip people up, what are good ways to phrase questions, and even, what's the best way to order things in a way that makes sense to consumers. So they've done a lot to eliminate jargon and make sure that the application is set up in a way that will really help people move through it and have success in filling out the application. So once the application is filled out and submitted, the applicant will get their eligibility determination. And what happens next depends on what coverage they're eligible for. So if that person gets Medicaid, they go ahead and enroll in Medicaid and their coverage starts right away. If they're going to be eligible for tax credits or to buy a plan in the marketplace, they still need to do another step, which is choosing the health plan that they're going to enroll in. And we know that choosing a health plan is something that can be very difficult and stressful for consumers, and people have had a lot of good reason to be concerned about that process before the Affordable Care Act. They ask questions like, if I have a pre-existing condition, will I be able to get coverage, or will that coverage be excluded from my plan, or will I have to pay more in order to purchase coverage? It can also be hard for people to find out what benefits are included in their plan, since many health plans currently do exclude some services that most people will need at some point. It can also be hard to choose between plans because they each provide their information differently, so comparing and sort of figuring out what your best option is can be really difficult. The Affordable Care Act makes this process much easier in three ways. First of all, it prohibits plans from denying people based on pre-existing conditions. So if an applicant has a condition or has had breast cancer in the past, they can go into this process of picking a plan knowing that that will be covered under any insurance plan that they pick, that they can't be denied based on that condition, and that they're not going to be charged higher premiums because of that. The second important way that plan selection is easier under the ACA is that all plans that are sold on the marketplace will now have to cover a set of essential benefits. So right now, some plans don't cover important things like maternity care or prescription drugs or mental health care. Under the Affordable Care Act, every plan in the marketplace has to cover a set of 10 basic essential benefits. Includes things like prescription drugs, lab services, hospitalization, emergency care, mental health care, maternity coverage. So that can give people real peace of mind as they're shopping for a plan, knowing that no matter what they choose, those basic services are going to be covered. The third way that the ACA makes picking a plan easier is that the application will have the same information about each plan set up side by side so people can make a real evaluation of what's best for them. And it'll provide information that's really relevant to consumers. So, for example, somebody who has a chronic disease and uses multiple prescriptions might be interested in finding which plan covers the most of the cost of prescription drugs. Or somebody with a really close relationship with a particular doctor or specialist might want to check and make sure that the plan that they're choosing includes that doctor within the plan's network. And there will also be a calculator with that in this plan comparison section that will help consumers see, okay, this is how much choosing this plan is going to cost me each month.
Okay. So it sounds like there's a lot of as support in some ways for folks to actually make a better informed decision, correct?
Absolutely, absolutely. And there's been a lot of time and effort put into making this as consumer friendly as possible, but we do also recognize that there are going to be a lot of consumers who are going to need help or have questions. And trained certified assisters will be available by phone, in person, or online to help people either fill out the whole application, or if they're just getting stuck on a particular question or have, some concerns about how to pick a plan, they'll be able to get that help. I also wanted to mention, we know that the marketplace and the application will be fully available in Spanish and English, and HHS is also working on some educational materials in additional languages around the marketplace. So it's still a work in progress, but there's a lot more to be done before people start enrolling in October, but we're really excited about the consumer-friendly efforts that have been put into this application so far.
Okay. Let me ask you just a quick question. What are some of the most important things, say, for states, kind of thinking in terms of going forward to make sure that everyone eligible gets enrolled? Is that something that, obviously folks should be thinking about now, but, can you tell our viewers, hopefully, exactly kind of what possible states, might be doing?
Yeah, absolutely. So states want to make sure that that application process is as easy as possible, that it's as clear to consumers as possible. And they also want to make sure that there's plenty of assistance available for folks. We know that choosing health coverage can be different, and help needs to be available every step of the way. So trained, certified professionals should be available online, by phone, and in person for people who need help filling out the application, and who can really be there to and those folks will be there to make sure that the consumers can really pick the plans that work best for them.
Okay. Thank you, Sarah. Thank you. Now I want to turn to our final guest, Jenny Sullivan. You're the director of the Best Practices Institute with Enroll America. And I wanted to just allow you to kind of talk about what methods or strategies you found that are most effective in getting people to the virtual door of these health insurance marketplaces.
Yeah, sure. Thanks, Airrion. What I'd like to do is actually dig a little bit deeper on some issues that Sarah brought up, drawing on the research that Chris mentioned before that Enroll America has done. Enroll America did a survey involving just over 1,800 folks last fall. And one of the issues that we dug deep on there was help. What kind of help are people going to need? What are their expectations? How can we meet them? And I think it's important to note when we talk about who we surveyed that 22% of those that we surveyed were Latino and 16% were African Americans. 22% of those who were, 15% of those who participated in the survey participated in Spanish. So just to know these are hopefully pretty well-rounded and representative findings. So we know that even though the application is really making great strides in terms of how people apply for public benefit programs compared to how they've done so in the past, people are going to need help getting through the process. And I think Sarah did a great job of illuminating the vision for how that help will be available. People are going to need help getting through the application. They're also going to need help with the complex decisions related to choosing a health insurance plan, particularly if they're choosing a plan on the marketplace where there might be lots of different options. So although people are going to be going through the process online, whether they're doing that with an assister or whether they're doing that on their own, I think it's important to think first about how connected these communities are. Is online really the place that they're going to go? Well, our research found that even though sometimes I think we are tempted to say, well, these folks have real barriers to access to technology and they're not going to be going online, that's just unreasonable. I think if we step back from that for a moment, our survey findings actually show that 3/4 of those in this population likely to be newly eligible for coverage are using the internet frequently. 3/4 are using text messages. Half of them are on Facebook regularly, and a slightly smaller portion, around a third depending on the population subsegment, are using smartphones. So they are online and they are connected. However, when we took the next step and asked them, all right, you're connected to the internet, you're getting information that way, how do you feel about buying a health insurance plan online? That seems to take it a step too far for most folks. Over half of those we surveyed said, buying health insurance is different. It's different than buying shoes or buying a plane ticket. This is an important decision, and I think I actually want help from somebody who knows what they're talking about. So although going online and being able to explore the options that are available is really important and an important way that we can build trust and that consumers can look at their options, feel like they understand the process before they dive in head first, they're going to want to have that sort of shoulder-to-shoulder assistance from someone who knows what they're talking about when it comes time to actually enroll. And so, as Chris mentioned before, actually I'm not sure if you did mention this, Chris, but over 3/4 of those who are interested in enrolling in coverage do want help in person, and those numbers are even higher among communities of color. So why is help so important, other than kind of the things that we've laid out so far? Our research also looked at sort of people's past experiences purchasing health insurance coverage, and a lot of them have done it before. 44% have tried to purchase health insurance before on the individual market, and their feelings are really negative. They come out of the process feeling stressed, feeling worried, feeling overwhelmed, feeling like they're not in a position to make an empowered, informed decision. How they want to feel when we go, okay, let's turn that around. Let's get you to a place where you actually want to enroll in coverage. People want to feel confident and reassured, secure, in control when they're making those decisions. The key to bringing those two worlds together and bridging that gap is really that very knowledgeable in-person assistance. And so every state is going to have what's called a navigator program, and that's sort of a bare minimum. Those are going to be folks helping people connect to coverage through the exchange and also helping them learn about other options that might be available to them. There are some other options depending on the way the state designs its exchange, so that there'll potentially be other types of assisters on the ground. Who do people want help from? Well, our survey found that fortunately, since we're going to have these folks on the ground, people want help from someone whose job it is to help. Now, technically, they say they want help from someone, a state employee whose job it is to help. I think the whose job it is really the important part of that statement, because they want somebody who is trained in these issues, who can give them the confidence that they're seeing through that fine print, or they're getting around all of those complex questions and really are able to make an informed decision. So it's really crucial that in addition to the minimum sort of navigator programs and maybe in-person assister programs, which are actually kind of two different things, even though it sounds like we're throwing around a lot of jargon here, it's crucial that there's enough trained and knowledgeable assisters available, and that they have core training on all of the health insurance affordability programs available, the eligibility rules and the process for enrolling in those, health plan options, and then really importantly, how to use health insurance coverage. A lot of these folks have never had experience using traditional health plans before, and so they're going to need a lot of help understanding the terms. What's a copay? What's a premium? Where do I go to get help? Sure. What's a primary care provider? Things like that. In addition to that, when we think of how we're going to be reaching communities of color in particular, it is crucial that assisters are trained in cultural competence. A lot of families with mixed immigration status have a significant barrier to overcome when it comes to public charge. Who's helping them understand that this is not a problem for them, that they are welcome in this program? Promotores have been really a successful example in the past of how this has worked well to connect families to Medicaid and CHIP coverage, and so as we sort of cast a wider net, it's important to think about some of those lessons learned. It's also, of course, crucial that, excuse me, let me get a little bit of water here. It's also crucial that that assisters are able to provide assistance in the language of the consumers they're trying to serve. Absolutely. And are able to help them get over some of the literacy barriers that they might otherwise encounter, whether or not English is their primary language or not. We know literacy barriers are going to be significant. So. And then finally, I think just echoing what the other speakers today have said, it's important that those providing assistance are trusted members of the community. Let's see. So I think sort of wrapping up this idea of assisters, I think it's important to think about who is providing assistance. It's not always the folks who are providing kind of the outreach messages, often the family members, often mom or partner providing that assistance, or excuse me, providing sort of the outreach messages. That's one important piece of it, but when we think about who's actually providing assistance or where people might go to learn actually about the application, or how do I get through this, or I started the application and then I struggled and here's where I got stuck, they're going to be going to their providers oftentimes. There's tremendous trust for natural reasons in the healthcare community, in doctors and nurses, in community health centers, in hospitals, and all of those entities need to be prepared either to provide assistance in a formal capacity or understand how to answer some basic questions and provide referrals to those who can provide that formal assistance. So I think those are sort of the key points when it comes to assistance. that I wanted to touch on, if we have a few more minutes.
We do, we do.
Okay, terrific. I wanted to touch on something which is sort of what happens behind that curtain that Sarah talked about in terms of someone's going through the process and trying to enroll in coverage, but how is the system designed and what decisions are states making to make sure that this process is as consumer friendly as possible? The Affordable Care Act included a critical concept when it comes to this eligibility process called no wrong door. And this is really the notion that although households are going to include people who are eligible for different programs. Many times you may have parents who are eligible for coverage through an exchange, while their children are eligible for coverage through Medicaid or the Children's Health Insurance Program. You might also have people with mixed immigration statuses in the same household, some of whom will be eligible for new coverage options and some of whom won't. How do we make sure that all of those people can go through the process using one application and as they're connected to the different coverage that's available that might be administered by different agencies? Some of it might be administered by the state, some of it might be administered by the federal government. How do we make sure that all of those connections and handoffs happen seamlessly and smoothly?
Yes.
It's a huge challenge, as you might expect, but this concept of no wrong door is really the policy underpinning that says, agencies, you all have to work together. Someone fills out, a household really would fill out one application, and behind that magical black curtain, all of that information has to get handed to the right entities, and the person has to get an eligibility determination for everyone in their family, and then they have to get connected to the programs for which they're eligible. Instead of going to the exchange, seeing if I'm eligible here, getting rejected, going to Medicaid, going to CHIP, and so on. It should be a single seamless process. Part of that is really this vision that we're going to turn the verification process on its head. Traditionally in public programs, people have been asked to bring stacks and stacks of paper to an eligibility office. They may have to come in for an in-person interview. They have to bring original documents. Sometimes folks were even bringing original birth certificates and things, valuable documentation, sometimes mailing them away to eligibility offices. Okay. We're turning that on its head now and saying, you know what? The government actually has most of that information about most people. And if we use a social security number, we can really unlock the gates to a lot of that information and see it all in front of us. And so the way that states are building the system and that the federal government is building the system is to sort of use this data services hub, is the jargon that they're calling it, so that an individual would be able to put in the social security numbers for the individuals in their household and then learn, this is how much money we think you made last year based on IRS data. We're pretty sure you're a citizen. We looked at, the Social Security databases or at Homeland Security to confirm that you have an alternate status that if you're not a citizen, but you're here legally. So we're able to look at all the information in one place without requiring the consumer to bring paperwork, without requiring them to verify things later. We know it all already, so let's just skip that process, that step of the process, and make this as quick as possible. And that's part of what allows real-time eligibility determinations to be something that we're considering really for the first time this fall. In the past, Medicaid decisions could take anywhere from a month or more, sometimes multiple months, and now we're looking at a system where for simple cases or for the majority of sort of straightforward cases, people are hopefully going to be getting determinations either right there in front of the computer or very soon after they submit their applications. So those are all really big, important visions for how this is going to work. Mm-hmm. Right now, I think state Medicaid agencies, CHIP agencies, the exchanges, either those run by states or the federal government, federally facilitated exchange that's being set up, they're working hard to figure this out. And I don't think that it's definitely the vision and where we want to go. It's going to take a lot of collaboration, a lot of hard work, and a lot of encouraging folks and reminding them that this is the vision to make sure that we actually get there. So.
Sure. Kind of listening to all three of your presentations, I want to ask you a quick question, Jenny. Clearly kind of shopping, signing up for coverage is going to be easier in October than it has been before. But it's in some ways still doesn't sound like just an Expedia for health insurance, just some kind of portal where you just kind of go in there and 3 clicks and you're done. But, I think you've touched on a lot of these things, but in some ways, can you maybe distill, what can be done to kind of help the process be easier for folks?
Sure. I think really the most important thing, I don't think that the average consumer actually expects it to be like Expedia. like I said, our research shows that the people do get, this is important. This is literally life and death, these decisions. They understand that and they're willing to take the time. But what we need to do on sort of our side of the deal is whether you're a health center or a provider or some other concerned community stakeholder, is make sure that we have the right answers for people, that we're providing them consistent, accurate information, and when we don't know the answers, that we're connecting them to people who do. I think making sure that accurate information is available and that people can get connected to assistance is going to be absolutely at the heart of all of this.
Okay. Thank you. And again, for those with the media that are viewing now, please email your questions to bfisher@familiesusa.org. Again, that's BFISHER at FAMILIESUSA.org. I've got a couple questions here that we've already kind of gotten in, and I wanted to go ahead and kind of open up and ask you guys some questions that folks that have sent questions in already. And I think this may be kind of geared more specifically to maybe Chris, maybe Jenny, I don't know. Have you received, this is maybe a two-parter in some ways, I don't know. Have you received any commitments from historically Black community organizations to kind of help in your efforts, and kind of what type of coalitions will be important for Enroll America kind of going forward in outreach?
Yeah, sure, I'll take that, and Jenny can add if I miss anything. So NAACP is on our advisory council and is an important partner of ours nationally. There may be others that Jenny will add later, but I think to answer the other part of the question, we're going to have a pretty robust constituency engagement department, and within that team have an African American director who works on these very issues, and I'll highlight a few things. I mean, one, on building coalitions on a national level to make sure that we're working with the right organizations, but also on a state level. And beyond that, really thinking through a couple things. On the ground is when I talked about the grassroots organizing, making sure that we're designing program for the people that are organizing in communities, that they're organizing, both the organizers themselves are reflective of those communities, and that the tactics that they're using, the way that we're communicating with those communities is effective and reflective of those communities. And so this department will be in part responsible for that on the grassroots level, and also working with our digital team and our communications team to ensure that we're doing all the right things to communicate with different people. There's certainly websites that are that gear towards certain constituencies more than others. And then communications as well, thinking about radio and TV and other, mail and things of that nature. So I think that team will certainly expand our partnerships because, again, we're kind of in the early stages of taking what's been done and all the national partnerships that we have and bringing it down to a much more local level. Okay.
So you are very much kind of leaning towards tailoring toward various specific regions. Again, even past, say, just the state level, you're trying to get down into those trusted messengers.
Absolutely,
okay.
Yeah. And again, it ties in part with the data and analytics that I talked about. That we have some ideas, and we'll work with partners on the ground to figure out what are those messengers, who are the right organizations. But as we do it, as we begin the process, we'll get a better sense of what's working and what's not. This team, the constituency engagement team, will help keep us honest and focused on the right things.
Okay. Thank you. Let me go to another question here. Who will be helping consumers? And I think this might be more geared for maybe Sarah and maybe Jenny as well. But who will be helping consumers, and why should people trust them? I think is kind of the overall question. There may be sites out there that are just popping up saying enroll here, sign here. How do people know that those can be trusted, or any of those kind of assistance that's being offered?
That's a great question, and we do know that there are already sites popping up or mail being sent to people, sort of claiming to be a part of this new marketplace. And folks need to be very, very careful with where they're getting their information from. We really encourage folks who are online to access healthcare.gov or cuidadodesalud.gov as sources of information. We also know that the hotline for the marketplace will be open in a few months, and that will be also a source for people, even before they're able to fill out the application, to call in if they have questions or concerns.
Okay. Thank you. Let me ask, do you have you received any other sort of, say, commitments from other organizations kind of going forward for, you'd mentioned NAACP.
Sure. Yeah.
Are there any others that you could mention as well?
NCLR is an important partner of ours.
Okay.
You know, slightly different tax, but also, you know, you think about young invincibles as well. The young population is very important, pretty high rates of uninsurance. And I don't know, Jenny, if there are others that come to mind. I don't have the whole list of all of our partners off the top of my head. But.
Yeah, I mean, we've got over 50 different partners now, all of which represent really key constituencies that we want to be reaching, and making sure that they have the tools they need to move a unified message and reach their constituencies in the best way that they can. In terms of communities of color, we've also got partnerships with the National Urban League, the National Medical Association, the Joint Center on Political and Economic Studies, as well as the National Hispanic Medical Association. So we're really trying to make sure, in particular, like I mentioned before, that we're reaching providers and giving them they already do a lot of work to provide the health care to the people that they serve, and I think asking them to take that next step and help folks connect to coverage isn't always a natural fit. It makes sense to the consumer, but in terms of what the provider has to consider in the scope of their work, that can be a challenge. So we're trying to figure out ways to make sure that they feel they have the tools they need to do this, and that it isn't as heavy of a lift, so they can help consumers when they're asking.
So it sounds very collaborative and dynamic kind of going forward, are two words that I would think of. Let me ask you, Jenny, direct another question towards you. What's the single most important practice that you would think needs to be adopted to make the promise of getting everyone enrolled a reality?
Gosh, that's a really hard question, Airrion. I don't think I can answer with a single answer. We need the systems to work well, and states and the federal government are doing their absolute best to make sure that that they're as good as they can be by October 1. But we know they're an evolving process, and they will continue to get better over time. Particularly once folks start using them, when you figure out what doesn't work, we want to be able to, through even our grassroots campaign, look at what's going on the ground and turn that information around, get it to policymakers, and make sure that in real time we're able to encourage some good solutions when things aren't working well. The other side really is just assistance, assistance, assistance. We don't want people to have a bad experience and tell 10 friends. We want them to have a great experience and tell 100 friends. So it's really making sure that people have all the tools they need to get through this flawlessly.
Okay, very good. This question may get back to kind of some of the things that Sarah was talking about. You talked about resources. I wanted you'd mentioned, how folks can trust various offers, and kind of speaking to that concern. When folks have questions, where do they go again? Like, what are they going to, at this point, if they're interested, like, where should they be looking, kind of going forward in the months to come?
Yeah. So there's definitely a lot of good information already available on healthcare.gov and cuidadodesalud.gov. There's also ways on both of those sites where people can provide like email addresses and their phone numbers to get emails and text messages as things are rolling out, so that they do know, once a new website is live, or once sort of new options are open, what's available.
Okay.
And I would just add to that also, just because I think we can't blanket the airwaves and the internet with accurate messages enough, that Enroll America has also been going through and creating sort of state profiles. We know that the information that consumers are going to need to make these decisions varies considerably by state, and so folks will also be able to, if they happen to come to our website, click on their state and get the right link to the exchange that's operational in their state.
Okay. Well, thank you. I think that's all the time we have for. We've got one more question. Thank you. Excuse me. I'm sorry, Chris. Chris, you mentioned you worked on a campaign last year specifically. How did you use the tactics that you kind of mentioned today, basically, to kind of engage communities of color?
Yeah, well, so some of the ways that we're setting up the organization this time around are comparable to the way the organization worked for me. I was in the state of Ohio running the campaign for the president there. And we similarly had this constituency engagement department that worked really closely with the other departments to ensure that all of our tactics on the ground were informed by some of the lessons that they learned. I think what's really important, kind of on just a fundamental level, is that we make sure that our organizing is always reflective of the community, whatever community that is. And I think that was kind of the ethos there, and I hope that it'll be a part of the ethos in this community. I mean, I think specifically in that area, specifically in Ohio, we really thought about, as it related to African American organizing, what are the tactics that we needed to use that were most effective. I thought working within the faith community, I alluded to that earlier, was really important. So identifying what we called in that role congregation captains, people that were active members of their community. And it wasn't about the street that they live on, but rather where they go on Sundays, and were really seen as leaders. And I think using them, again, to go back to something that all three of us have mentioned today, the importance of trusted messengers. And so establishing relationships and building that trust with those messengers, and then making sure that they had the tools necessary to help, inform and persuade and mobilize people in their community. And another thing that I mentioned earlier was some of the work that we did within small businesses, specifically barbershops and beauty salons, is something that we've actually did a lot of organizing around. It was very effective. In that case, it was more geared towards voter registration. And so I think that was about taking action around voter registration, but it was working with people in those businesses or in barbershops saying, hey, can you put out this information? Can you put out the voter reg? And as people come in, talk about this. Clearly, we're not going to ask people in barbershops to enroll, to sit down with an application and enroll, but we can ask them to take a more active part in their community, and as people come in and out, talk about, hey, do you know what's happening from October? Do you know what's available to you and to members of your family?
Kind of a place of discussion, really.
Exactly.
Yeah.
Exactly.
Okay. Well, I think that's all the time we have for today. I want to thank everybody for joining our guests, Chris Wyant, Sarah Bagge, and Jenny Sullivan. And for all of our participants, do remember that they're available as resources kind of in the future as you're, digging into this issue, preparing your stories or any kind of stories going out. I also want to quickly mention that Families USA is going to begin issuing our premium tax credit report in about another week or two. It'll be a 4-week rollout of state-based reports about those eligible for premium tax credits. And we'll have race and ethnicity data included within that report, and county data as well. So it'll go down to the county level. And again, I just want to say thank you guys for joining us. I've really appreciated the information that you brought, and I hope it'll be helpful for those who tuned in today. Thank you, and have a great rest of the day.